Hi, and welcome back again to your favorite program, Wounds of the Heart, where we are here to help others heal their wounds caused by trauma, anything, abuse, economical pressure, mental issues here and there. And today, I'm glad and honored to have a beautiful lady who had been on this program, yes, with me this year. And today, she's also here to help discuss a topic that is a bit sensitive, but a topic that would also help us elevate whatever we have in mind when it comes to grieving and bereavement. This is Hope Channel. We are live on Hope Channel social media handles, Facebook, YouTube, TikTok, and wherever you find Hope Channel. We are live. You can send your comment, your question contributions, and we will have time to reply them. I have been your host, Pastor Daniel, as usual, and you can also follow me on all social media handles, Chaplain Abidu Bidiaba. You can get me on TikTok, on Instagram, on Facebook, and on YouTube as well. So you can let us have chat there. Today, I have this beautiful lady. As I said, she is a clinical and health psychologist. She has been practicing this for more than 8 years. And one intriguing aspect of her too is that she is a member of the Ghana Palliative Care. So some time ago we discussed how it works right here on this program. Today she's here for us to discuss a beautiful topic, a topic that is a bit sensitive, as I said, a topic that everyone would want to hear and know more about it. Losing someone becomes difficult in life, especially when that person will be no more for you to talk and have a chat with. All those things you see are pictures and memories of the person, but you can't talk, or that person can't talk back to you. But what happens when issues like that hit a family or you yourself? So let me ask you, what happened when that the loved one that you cherish so much died? Have you been able to overcome the grief? Have you been able to calm the trauma that was associated to it? Today I want you to join me as we discuss understanding the psychological effect of grief and bereavement. And to help us discuss and cope with this is Marsha Boy Mashiru. Marsha, good evening and welcome to the program.
Thank you so much, Pastor Daniel, and hello to all your viewers and listeners out there. It's such a pleasure to be here, and thank you, Pastor Daniel.
So yes, that was Marsha, and she has been here before, and she's here. She has promised to help out to bring to your doorsteps issues like this as we are going through. Marsha, let's get back to business. Grief, bereavement. What are the differences? What is grief? What is bereavement? What are the differences?
Thank you so much. So, Pastor Daniel, when we think about bereavement, a lot of times we're thinking about grief, but in practicality, they are usually two different things. So, you would think about the experiences of losing a loved one. So that period is usually known as the bereavement. So bereavement is the time with which you know that you have lost a loved one. Okay. So bereavement doesn't have a timeline. So it's just a period, okay, an experience that I have lost someone. However, losing someone may leave feelings, emotions, thoughts, and that experience is what we usually call grief. Yes. So grief, what you need to understand from today's conversation is that grief doesn't only mean losing someone, it could also mean losing something that is very precious. So grief is a feeling, a thought, it could be physical, it could be emotional as you would expect, and also economical, it could be financial, it could be any other thing. So any reaction to hearing the news that you don't expect is what we will call grief. But when it's peculiar to losing a loved one, this period is known as bereavement.
So what of mourning?
Yeah, mourning is an act, so it's an expression. So mourning, you are mourning a loved one, okay? But we can also mourn other things. So grief and mourning would have some similarities when you're thinking about it. Yes, exactly. But it's specific to a response. Okay, so mourning is a response to hearing the news. Grief is a response, and grief is usually more psychological, you would expect, because we think about loss is when we come to think of a loved one. But loss could be a job, it could be a relationship you're grieving, okay? It could be just bankruptcy. You could lose all your money. So people have different reactions, and that reaction is what we want to think about when it comes to grief. But bereavement is when you lose a loved one. So that period, so we are all bereaved, or we are bereaving in that period of time.
So from what you have said to us, it means that it is normal. Grief is normal. It's not a mental health issue.
It is not a mental health issue because grief is not a diagnosis, okay? So grief is a reaction to something that has happened. So grief can happen to anyone at any point in time. So what we are usually, when we think about mental health issues, we usually have to think about duration, we have to look at frequency, and then how do you cope in life? Because we know mental health is about balance in your activities. So if you're not able to function as a human being, then there's a problem. So it means there's disbalance. So usually when you want to think about mental health, is this a problem? You have to look at the duration. How long has this been happening? How frequent has this been happening? And also, is that person able to go back to what they were doing? Does it disturb the normal flow of activities? Is the person able to go back to school? Is the person able to concentrate? Is the person having lapses in the memory? So that is how you can tell whether this becomes a problem. But grief in itself is not a diagnosis. It becomes when certain criteria is met. And I believe we would come to that part
exactly. So it means that, also means that losing someone someone you love dearly may have its psychological implications.
Absolutely. So the most fundamental one you see is sadness in someone. So when you lose a loved one, specifically, I think because that's what your focus is, you would see someone being extremely sad. They would not want to be doing activities they were doing. Their personal hygiene may struggle. They will find it very hard to wake up from bed. They sometimes feel like, I've lost everything in life. So they seem not to have feelings about future. They want to take time from everything else, and nothing else matters to them because they are trying to process what's really happened. So you would notice that some people will say, oh, I know this person is gone, but I just wish I could see this person walk through the door one more time. Or you say, I wish I can have that phone call. So what it means is that there's a psychological aspect to it. So intellectually or in your mind, you can tell that, yes, I know this person is gone. It's obvious because I was in the hospital, I heard the news, I went to check on the person, and I could see that the person is no more there. But it takes time for your brain to be able to process that, okay? And that sort of complex reprocessing is what we usually see as grief, okay? And it's different from everyone else. So sadness is the most expected thing to have when you grieve, but it's not peculiar to everyone, okay? Some people may actually just go very numb and quiet. Okay. And this is what society may feel like something is wrong with you. So you lost a loved one and you have no emotions. And you ask, are you okay? And sometimes they're being accused that maybe they are behind, you know, doing that. But yes, people have different reactions. And I believe having this conversation helps us to understand that grief is different from everyone else. So sadness and being tearful or crying is what you expect. The other part is that people may go very quiet. They may want to be in isolation. They want to be very quiet. They don't want to involve in any conversation with everyone. Some people may actually function very well, even better than they were before the person passed away. So some people, it's their way of coping because they haven't really processed. And I told you it's quite a complex process to reprocess what is happening. So those people usually may not have processed this. So this is what we call delayed grieving. Yeah, so it's delayed. So they are not processing, or they are not on the same page with you who has processed that I've actually lost a loved one. And this also applies to all other aspects of life. So heartbreak or broken heart. So one person says, you know, our relationship is over and I'm moving on. And the other person is like, oh no, maybe that I didn't hear this well. So the person will still keep trying to, you know, function and do other things. But reality is that something did happen and it changed an individual. Another thing you would notice about somebody who is grieving, it's is how they relate to people. So some people may may be very irritable. They may be very angry. So they may project their anger towards maybe the one who broke the news to them. They may be angry at everybody else because they feel, oh, you have a life and the person I love the most doesn't have the life. You don't deserve to be alive. This person deserves to be. So that sort of anger is also part of grief.
Okay.
And so aside having the stages of grief, so these are usually some of the characteristics you find when someone, so you have anger, denial, so this is the things that people know, but in the practical way, these are some of the things I will talk about. So sadness, of course, we all know you might be sad.
Exactly,
and then there will come a point where you feel there might have been something else you could have done. So there's a guilt or blame apportioning. If I went to this hospital, maybe things wouldn't have been this way. If I made that phone call, things would have been there. Or maybe I didn't have to give this sort of medication to the person. And this is peculiar to people who are in the palliative care or hospice care. Sometimes you feel like the medication you're giving to someone is making the person worse. Why do you give so much medication? The body cannot take it. Yes, but there's a reason for doing what they are doing. So yeah, you have a lot of blame and guilt also apportioning during the grieving moments. And I can't think of my head if there's another one, but I think these are usually the things,
the basics,
things you would see from someone. And of course, the last part is having some sort of an acceptance that, you know, truly this person is gone and I have to have my life back on and I have to function. So some people may have jumped from one stage to another, and it's like, okay, I'm moving on, I'm doing well. And then on the day of the funeral, you see that they break down even more than everyone else. Or actually after the funeral, you know, the process has gone on, everybody has moved on. But this person now goes back to that stage to restart the process. Yeah, so grief is not a straitjacket process. You can go between the stages from time to time. You can be very happy one day. You could be very miserable the following day. You can see yourself doing things that you loved. In another moment, you realize that you hate everything around you. And it's perfectly normal because grief is different from everyone. Yeah. The only thing that you should have in mind is that am I able to function? Yeah, so this is the question that everybody should be asking themselves. When all this is happening, am I able to have some food in my system? Am I able to pick myself up from bed? Am I able to get myself dressed and maybe, you know, show up to work? And as I mentioned, some people become very functional during that time because they're using work to cope with the pain. So they don't want to process the pain. So it's delayed for them. They don't process the pain. They bury themselves with work. So any work that comes, I'll do. I want extra hours. I'll come on weekends because they don't want to deal with the pain. So yeah, some people, you may see them to be functioning well, but this is not a healthy way of coping.
We'll come there, we'll come to that side. If it's not, so that you, at least those who are watching and probably have gathered a lot of things, mounted a lot of things to themselves, and they don't want to grieve. They will see its effect, why they should spend time to grieve. In case you just joined us, we are discussing understanding the psychological effect of grief and bereavement. How can we, as human beings as we are, death is inevitable. Everyone we are losing a lot of people in our lives. How can we understand this process so that at least if it's happening to me, anybody closer to you, you'll be able to help the person. So Marsha, let me come back again. Do we have types of grieving? Or it depends on the relationship with you and the person who is gone?
Yeah, so yes and yes. So absolutely, there's definitely different types of grieving that we have. So let me come to the type of relationship first. So the better or the closer your relationship with someone, the bigger blow it is to you, and you are most likely to have bigger emotions when it comes to that. So when you see someone crying so much beside someone, then you can tell that this was a very dear person to someone. So yes, it definitely affects the kind of relationship you have. So the further relationship you have from the person, the less likely to have such bigger emotions when it comes to losing loved one. Yes, and there are definitely types of grief you have. So you can have the normal reaction that we all have, and it doesn't have a timeline. And I think I mentioned from the beginning, it's not a medical diagnosis. you can't really say it because you have grief, you have a problem in your mind. So once you're able to function and do things the way you have to do, it's acceptable. So that is a normal grief for everyone else.
Okay, once the person is able to function and do his or normal thing,
activities, yes, it is considered to be okay.
Okay.
So there's no timeline, but sometimes we look at the period. So I mentioned that anytime you want to think about mental health, you need to look at duration, frequency, and the behavior changes. So sometimes when the incident goes, because we have 1 week celebration, we do 40 days, we do 1 year.
1 year.
So you kind of expected that when it nearing 1 year, your emotions should have decreased slightly. You're not expecting a drastic change, but you do expect some level of pain to reduce. But you can still have very strong emotions. Now, when it goes beyond a year, you have very strong emotions, so that is, you're looking at clinical depression, not just sadness and crying. So we're looking at a diagnosis here. So you have severe depression where you have had certain symptoms, negative emotions, feelings about future yourself, for a period of at least 1 month. You're looking at withdrawal from people. You look at extreme irritability. Sometimes you have this strong desire that I don't want to leave. So this is where you're nearing towards suicidal thoughts. You may not necessarily have a plan for suicide, but you do express feelings of not wanting to be alive anymore. Sometimes you do want to even join the person. You're not able to go back to activity. So you realize this particular person would spend most of their time locked in the room, expressing very strong emotions, so depression. Sometimes they spend most of their time even at the cemeteries. They are not able to have a life. They are preoccupied with the thought of losing the loved one. So such a person, you may be looking into having a more complicated type of grief because there could be a comorbid with other mental health conditions. It could be trauma, it could be anxiety, it could be depression, it could be other things. So this is a more stronger version of what normal grief will feel like. Yes, and that becomes a diagnosis, and it has to have some attention. You need to get some treatment or intervention when it comes to complex grief. Yes, but it's not to scare everyone. It's not everyone who have that. Yes, so it's usually a complex cocktail of things that happen there. So it's not automatic that if after a year you still have feelings and thoughts, it's not automatic that you have complicated grief. But you need to look at the duration, as I mentioned, the frequency of how many times a day you might be having those thoughts or preoccupied with those thoughts, the kind of emotions you express, anger, what do you wish to do with the thoughts you have. So some people might have intrusive thoughts, so those thoughts that automatically come to your mind. But then if you begin to act on them, that is where a problem is. Okay, so you can say, oh, I wish I joined that person who is gone. I wish, but you don't, it's just an expression. It's just an expression, but then you would constantly notice somebody is trying to, join the other person, cannot move on, and it has other, behavioral symptoms you would see. There's a body change, they will lose weight, they may not be eating properly, they may not taking good care of themselves, of their family members, they miss work, they are not able to cope. Sometimes they might be hearing voices. That is a very strong one, so yes, so that's a complex one, and it definitely needs attention.
Whoa. Yeah. So at which point, or depending on the relationship, that is where we go there. Yeah. So if the person is far distance, well, he or she is dead, blah blah blah. But if
it's dicey because sometimes people are emotional, so you can actually watch some news on the TV and have very strong reaction to what happened, and you begin to internalize it, and then you realize that you are reliving the trauma for the person, but that person has no relation to you. So that is what we call vicarious trauma. Yeah, so you might be watching an incident of an accident on the TV, and you just automatically go into that scene, imagining if it was your loved one, and you actually begin to grieve or mourn, as you mentioned earlier. Yes, so it's actually different from everyone. So that's why the answer is always like yes and no, and you have to know your personality type very well to know. So
so then Marsha, we are not supposed to probably brand people that they are doing too much, you have grieved so much. We should leave people to do that.
Absolutely. From psychological point of view, we allow people to cry. Our society doesn't allow us to cry. So they say, don't cry. If you cry, things will happen. And it's like you're not grateful to God for what happened. But then I believe there's a reason why we had to go through that. And I think it's even the scriptures, Pastor. So you have to come in there where we have seasons for everything. And
Yes,
we are being
yes.
encouraged to actually go to places like this where you see people mourning and grieving to understand what life is about. So yes, you have to allow people to express themselves. But what we should be cautious is how much we allow people to do things.
Okay.
Because everybody who stays with someone would kind of have a fair idea how the person is. Okay, so when you see someone is doing things, you just want to make sure that this person is not hurting himself or others. Once there's a threat to himself and the family, then you need to take the person to a safe space. Okay, so usually you would come into the clinic and then report the symptoms based on what it is. So they can assess if this is more than just grief or not. Okay, that's what usually happens. But aside crying, allow someone to cry, allow somebody to roll on the floor. It's part of emotions. And you know, grief, I told the expression, it could be physical,
exactly.
it could be psychological. You have to allow the person to express themselves. Sometimes you feel somebody wants to take off their clothes
Yeah.
and just want to run. You need to allow people to express their emotions, because the danger about suppressing those emotions is that one day they can have a nervous breakdown.
Hey.
And it can happen when you don't allow people to express their emotions. And usually it will happen at the least expected trigger situation. So everybody is seated in a good place, everybody is having a good time, and this person snaps out because this person has compiled things for a long period of time. And there was a trigger. Okay, it could be sound, it could be image, it could be smell, it could be anything at all. And that was the trigger for someone, and the person breaks down. So our people in Ghana, we have to allow ourselves to cry. If you feel this person may be overdoing things, then it's good to have, you know, some consultation with someone. You know, if it's going on for a period of time. If it's a one-off time, I think it's forgivable. Yes, but when it continues at every situation, this person expresses grief the same way, that's things overboard, and you feel there's going to be a threat to you or someone else, or even to themselves, then yes, this is where you have to draw a line, that this is not permissible, and you need to report it. Yeah.
You need to report it. In case you just joined, we are still discussing, understanding the psychological effect of grief and bereavement. We are still in the grief aspect. Masha, before we jump into the bereavement, psychologically, grief, can it affect or can it cause someone fear and panic? Can it allow somebody to lose concentration in life or something? Does it have that?
Absolutely does. So the psychological part of grief is that it changes you. Okay, there's a lot of changes in your body because your brain was used to seeing this person. So now you wake up in the morning, you don't see this person. So you have to find meaning in life. So this is like the last stage of your grief moment. What do I do without this person in my life now? So if you don't have enough coping skills, this is where you struggle, because you don't see picking yourself up, you don't know how you're going to function, you don't see your life without this person, because you have known this person ever since you were a child, you've known this person since you were in the university. So feeling that void could be very traumatic to the nervous system. So obviously concentration will come in, and lack of sleep. Usually when you have a lot of things on your mind, it's very difficult to sleep. So the brain is active, and that yearning for the person to be around you, not being able to process. That's why it takes time. So psychological effect is that it's going to change the way you see the world. You may feel like this world is not a fair place. You may feel, so it's the kind of meaning or attributes you give to the grief. So it's very important the kind of thoughts you have at that moment. So you can feel like this world is a very unfair place. I don't want to live anymore and I want to give up. Okay, so it's a thought. Someone can see that, oh, maybe this was a better place for the person, because this person has struggled with this medical condition. We've done all we could, but I think this person is where they have to be. Okay, so the kind of perception you have about losing the loved one. Someone may say that, this hasn't been fair, but at least where this person is going may be a better perception. So maybe religious coping comes in here and be able to explain how someone feels. And of course, some people may change their personality.
Okay.
So they may feel like, I don't trust anyone else.
Okay.
So especially when it comes to the medical field, because you feel that you've given this person into their hands and you expect them to be able to do the magic sometimes. And when the outcome is not like that, you begin to have some sort of a reaction and also have a reaction towards medical practitioners. So sometimes you may see a medical doctor coming towards you, and that brings you memories of the time that the doctor came to tell you the news about your loved one, and you may go into panic attack. Yes, you may fear if you're supposed to be admitted at a hospital, you see certain types of doctors, you don't want to be consulted by them. Or if you go to, some people have a lot of feelings about certain facilities. So because you hear that, oh, once you get to that facility, it's like you are not coming back. So obviously, and maybe you had a loved one who truly, genuinely was there and didn't make it. So if they make a referral for you to go for a checkup in that facility, you're going to have feelings about it. So yes, it can cause some fear and panic for you. But then a lot of it comes from the fact that it's the kind of attribution you have given, the kind of setting you were when the news were broken to you. So you carry that trauma forward. So that is why it's important you understand yourself in that feeling, in that space, and then allowing our people to express their emotions at that particular moment will help to soften the blow when they're supposed to now resume work and life. Yes, so it definitely does change that. It can create fear and panic. It can make someone go into depression. Yes, so that is also another psychological effect of it. So some people just don't have the resources to cope. So for example, you will see someone maybe who has never had a loss of a loved one. So life has been good, no step backs, no obstacles in life, going on smoothly until maybe the most important person in their life is gone. And you realize everything changes for that person. They no longer feel safe because that was their safe person. They no longer feel safe. They no longer feel this world even makes any meaning. So some people may go into depression at that moment. Also, for some people, their lives will be changed because some people may lose parents. And how do they navigate this world? So that's also a trauma on its own, childhood trauma that goes into adulthood. For some people are going to lose children, and losing a child is one of the most traumatic experiences that one can experience. So yes, losing a child, losing children, you know, so lives are going to be definitely be affected. And it's important to know that you can speak to someone about it.
You can speak to someone about it. So one part that you said that I think we need to re-echo is the fact that suppressing emotion doesn't make you strong. It doesn't make you strong
at all, especially for the male gender.
We have been told from infancy that when you cry, are you a girl? So we have been ascribed to being a girl. So Berman is soon kind of the society tells us we shouldn't cry, so we are not crying. So even if a husband loses the wife, you see, he'll be involved with all those things, mounting the canopy here and there and doing that. But society had helped women to grieve. And they will sit, cover themselves, nobody even shake their hands. They will sit and people will go and come and people will rather cry with her. But when it comes to us, even your friends, male friends will come and take you. Like they're trying to let you understand the fact that what is happening is like it's normal, you're a man, they kind of cheer up and stuff like that. So I think that is the point I wanted us to also think about and make sure that the fact that you express emotions, especially when it comes to grief, doesn't mean that you are weak. Because she also said something that at a point in time it can nerve whatever.
Yes, you can have a breakdown. Basically, that is it.
And you see, one thing they would say that, oh, he was strong, he was walking around, and all of a sudden, but so please, let us be mindful of such things and let us express it. If you don't want to express it in front of people, go hide somewhere. And Charlie, cry soon, cry what you can cry. Come clean your face, come sit and smile, because you have expressed it. Because at the end of the day, it is your health that we are here for. It's your health that we are here discussing. Before we jump into, Marsha, why should we be so much concerned when we talk about grief? A word or two, then we move on. Why should grief be a concern?
We need to be very concerned about grief because we as a society have a different understanding of what grief is. So we do a lot of communal grieving and bereavement care, which is good. But however, sometimes we may overdo or underdo things. So having conversations around grief helps us to know how we can be supportive to people. So for example, when you lose a loved one, says that, oh, it's okay, you know, God knows best. Okay, so it may make meaning to someone later in life, but that particular moment it doesn't make sense. So not understanding even your words in that particular context may actually harm the person. Yes. So are you telling me that it was okay for God to take my mother away? Are you saying it was okay for God to take my child away, but not yours? So you can fall anger in the person, you can break the person down. Sometimes you may say that, oh, wherever they are going is going to be better. So in our attempt to help someone, we rather make things worse for them. Yes, so the reason why it's important to have this conversation is because you want to help someone. Because there's a very thin line between having uncomplicated grief and starting a complicated grief. And complicated grief is usually harder to detect because you would think this is okay because we have normalized that when you are crying, you should be behaving in a certain way. That's why people who are not able to express emotions, we begin to think that they are stone-hearted.
They're courageous, they are strong, they are whatever.
They're strong, but this is actually an anticipation for doom. Okay, and the time that person will have a nervous breakdown, as you were trying to mention, it may be too late because that person may not be in a good place, that person may not have a support system around, and it can happen anywhere. Okay, and usually if you see someone walking like this, which is your first reaction to help the person to run away. Okay, so that's why it's good to talk about it. And two is that knowing that sometimes in an attempt to help someone, we actually push them away. And this example I'll give, especially because of my field, is working with mothers who have lost babies. Sometimes they find it very difficult to go back to their community because everyone says that, okay, I saw you with a belly, baby is where? Is it girl or a boy? Was it, you know, normal delivery or you went under the knife? So that expectation, you can imagine dealing with those bad news in the hospital, all the professionals out to your bedside all the time, and then going back home, and the only thing you want to do is to be able to cry it out, to have some time for yourself. And you have people coming in. Oh, congratulations. Is it a boy or a girl? Is it a boy or a girl? You have church members coming in. Is it a girl or a boy? Congratulations. We heard you went to the hospital. So where's the baby? We want to see the baby. And this kind of things can create a lot of anxiety for people. So to the extent that some of the mothers don't wish to come back home. They wish to relocate to a different place altogether. And you can imagine the emotional toll. Leaving a place you were once comfortable and happy, you live there your whole life just to move to a new place you have no idea, just because of the fact that someone may ask, where's the baby? So this is particular to the mothers, but then it cuts across everywhere else. You know, everybody knew you in an area, and all of a sudden they see an ambulance coming to your house, taking the person, and it's like everybody, when you are even walking, oh, how is the person? Is the person doing well? When can we visit? And you have no answer because the person may not have made it even right from the ambulance. So sometimes we need to understand that grief is different. Grief is hard. And grief can't make or break someone, okay?
Grief is different, grief is hard, and grief can make
or break
someone.
Yes, so grief can make someone become very resilient and do all the wonderful things they've ever planned to do because they are doing it in an honor of the person. And same grief can break someone where they see no meaning in life and they just want to end it all.
All right, so that's Marsha. We are still discussing, understanding grief and bereavement and the psychological effect of it. And three things: grief is hard, grief is
it's different from everyone.
Grief is hard, and grief can make or break someone. I want to pause here. We'll go for a quick commercial break, quick break. When we come, we'll continue to know how to cope and how to help someone. Then we jump into bereavement and we'll bring this discussion to a close. Please don't go anywhere. I'll be right back. Yeah, welcome back from the break. We're discussing understanding grief, psychological effect of grief and bereavement, and how can we help others who are going through, especially the one who is closer to you, the one who lost a dear one, and especially you, when you lost a dear one, what did you do, and how were you able to overcome or go through this system? With me is Marsha. She's a clinical and health psychologist. She's a member of the Ghana Palliative Care. She has been doing this thing for more than 8 years. She's experienced and she's here to discuss. In case you just joined, we are discussing grief and bereavement, how to understand the psychological aspect of it. Can someone grieve because he or she wanted to give birth to 2, 3, girl, boy, and she got opposite of what he or she is asking? Can somebody grieve with that?
Yeah, Pastor Daniel, I'm happy you've raised this question because, as I said, that's an area that I'm very passionate about. Yes, the answer is a big yes, because I mentioned that grief could be anything at all in life. So it does not only specific to losing a loved one. So there was an expectation. You are a couple, you have dreams, you maybe grew up in a family that had a lot of children, or the opposite, and you had a certain idea about how things should be. So before someone gets to the point where they feel everything is lost, they may have had trials, okay? So those trials would determine how they're going to grieve about it. Okay, so is it just not coming? Did they have bad outcomes and it's not coming? So I hope you get where I'm driving to. So you might have certain experiences that puts you at a higher risk to feel that I don't feel any hope in this situation. Someone may just genuinely could not make it happen. Yes, so their grief will be different from someone who has had several losses, who have had several bad outcomes, who have had several times doctors coming to them and letting them know that this is not what you expected to happen. And sometimes what may be a breaking point for someone is that someone's pregnancies could actually go all the way to almost 10 and the baby just didn't make it. And you are just telling yourself, I was just this close to getting what I've only wanted in my whole life. So maybe this is someone's prayer point. This has to be someone's. Everything has been going on well in life except that thing. So that will definitely have a reaction. So once you have a reaction to something that you may have lost, you may not have had. So it's a lost dream because your identity now shifts. You've always wanted to be husband, you wanted to be mother, father, but you remain as husband and wife. So that dream of becoming a mother and a father is not happening. It could be a loss to someone, but it is the response and the meaning that thing has for you. For some people will say, if I don't have a child, I'm okay with it. I'm okay with that. I can adopt, I can take care of other people's children. My family has a lot of cousins, nephews, so I'm okay. So you see, in that person's situation, you can't say that this person is grieving. Yeah. And another person may go through number of losses and arrive at the point where they feel there's actually something wrong with them. Whoa. And that could be a trigger for someone to say that, you know what, I'm just not worthy. Everything is falling apart. Why am I even alive? Because this is the only thing I've ever wanted in my life, to have my own child, and it's not happening. What else? So a lot of perception and thinking comes in here. And I always try to remind ourselves that how you think will determine the outcome of certain behaviors, because our thoughts are very powerful. So these same people are all not parents, but one's thoughts and perception about not being a parent has been more of a positive outcome, and they have accepted and they are doing something about it. And then someone may have a less positive mindset because of the experiences they had, and that will predispose someone to have feelings about it, and this is where they're going to have something that you think is grieving. Okay, so yes and no again when it comes to mental health.
So if grieving becomes so overwhelming and persistent, or begins to affect your personality, going into to have someone who is a professional doesn't mean you are weak, but it means that you want to allow your mental health to be stable. With that, Marsha, how can we cope and how can we help somebody who is grieving? If the one who is grieving, how can he or she cope and the one who is closer, how can we help the person?
Yeah, so take it from 2 points, as an individual and as someone who is helping someone. So as individual is allow yourself to feel whatever is coming. It could be anger, it could be crying, it could be questions. Sometimes you just need a little clarification. You may need a little closure. So sometimes you may go back to the scene to have that closure. So I'm giving an example again back to the mothers who may have had a loss. It's okay to look at your baby who you have lost. There's nothing wrong with that. If you can't do that, because that will be a part of closure for you. If you want to spend some time with the baby that you have lost, it's okay to do that. Okay. Some people may not have the courage to do that. So this is where memories come in. You can take pictures to keep it for later use. You can keep certain items from the baby from the hospital that may be helpful. This can also apply to people who have lost adults. So you may not have been there at the time the news were broken to you, but you have a period where you can actually go back and look at the person. And that sort of closure may be helpful. If you still don't want to do that, it's okay to have pictures if you can, or you can actually maybe have some consultation with a medical staff to understand what really happened. And sometimes you realize that when you begin to explore what's happened, you realize that, oh, we actually did everything we could for our loved one. So it's okay. I now understand, because I thought I was at fault. I thought I didn't do something. So that sort of understanding and realization helps people to cope. So memory making is also one of this is one of the key things when it comes to bereavement care, or it comes to grief or mourning that you may think about. Time. They always say time heals wounds. Okay. In natural sense, when you think about it from the practical perspective, it doesn't really heal the wounds. What it does, it just lessens the impact, because you may never be able to get over the fact that this person is never in my life and I'm never going to see this person again. So that sort of realization is difficult to say that your wounds are healed. It may not be healed, but this is just more like an idiomatic expression. But what you are thinking about is that you should feel less distress when you think about your loved one, especially in the manner in which it happened. So if there's that decrease in emotional tension, then it's okay. You don't need to be able to function very well and, you know, smiling all over the place to let people know you have healed. You can actually still be crying from time to time. You may go to work and feel like, today I just can't work. It's just a hard day. That's all part of coping. So grief could be like this. So there'll be days you feel very happy. You are able to go for parties, functions, meetings, summits. You can do all that. Then there'll come a time where you just can't even get up from bed. Once you know you can at a point in time, this is also coping, okay? Then I think one of the other things you might be thinking about is talking.
Okay.
So that's what we call a narrative therapy, where you are able to talk about what has happened. Sometimes because of how things may have happened around the death of a loved one, you as a family even didn't have time to talk about what really happened, because you have someone doing the arrangements, somebody's doing this, another person is doing that. So in the midst of all that chaos, no one really sat down to ask, okay, so how are you really? Like, what has been happening? So you need somebody, you need a good support system. So always build your small village, okay? Have someone to ask you, how are you really? Okay, so this is not a Ghanaian play, how are you? I'm fine. So it's more like, how are you really doing? What's happening? Is there anything that can be of help? And this way goes to supplement what I was saying, that sometimes you can say something trying to help someone, but you're rather pushing someone away. So don't say that, oh, God knows best, it's okay, don't cry. You can just say, is there anything I can help you with? It's okay to cry, I'm here. Okay, can I bring you some tissue? Can I bring you some water? Can I hug you? So there's a few things you can offer someone when they are going through a lot. So I'm moving on from individual to self, okay, to other people who are taking care of the. So you have to allow people to express emotions. Sometimes we have mothers who are coming home, everybody's like, don't cry, otherwise another baby is not going to come. Yes, so things like this, culturally, you need to honor your culture, but then you also need to have some science backing up. So science backing up in psychology will always tell you have to find an avenue to express your emotions, whether you breathe out or you punch a pillow, which is a soft aggression, managing anger, or just being able to cry. Sit down and cry it all out, and then you wipe your tears and start afresh. So whichever avenue works for you and it's a healthy way, it is. The bad thing to do is to be able to involve yourself in things that are not healthy. For example, taking alcohol or substance use, which sometimes the male gender is more prone to have because they are not talking about the pain. So let's go with the boys, take some brown bottles, green bottles, and the pain will go. Yes, it definitely goes for that moment of time because you have some euphoria. So it pushes away the pain you have. But then the realization will definitely set in for you, and that will hit harder for you. And in order not for it to hit harder, you go back and increase it, and that's how addiction starts. So drinking and taking substances is not a healthy way to deal with things. Some people engage in risky behaviors. So you realize that some people want to bet all the money they've had or sell all the properties because they are in pain. So usually what you want to do is to avoid making life decisions during that period. So I want to move houses, I want to sell my house, I want to sell my car, I want to move to a different country. Some people would want to do some medical procedures for people, for example, who cannot have children again. Then I want to tie my this, I want to do that. So we want to avoid making decisions that are very important during that period because it's grief and you need to be able to grieve that moment. And I think one of the things that we'll keep in mind is that everybody is different. Okay, so don't say it's been 2 weeks, it's okay. It's been 4 months, it's okay. It's been almost a year now, you have to move on, it's okay. You can say that out of consent, but this is not very helpful for someone. So you can just keep checking in with someone. How are you feeling? Are you getting better? Is there anything that can be of help? Should I do this? Should I do that for you? Can we do this together? And making memories or keeping the person's memories should not be a taboo subject at your home because that's also a way of suppressing your emotions. So some people, because of the pain they have, they want to hide all the pictures, they want to hide all the belongings of the person. And then there'll come a time where you really wish, oh, I wish I had something to remember.
Okay.
Yeah, so if you feel looking at things might remind you of the pain, you can park them somewhere in a safe space and revisit anytime you want to. That'll be very helpful than packing everything away and then regretting that you wish you had just one thing to remember this person. And with time, you realize that you begin to forget the person. Their voice, their smell, how they laughed, you begin to forget all that. So what is left is actually the tangible things that you have, a bracelet, earrings, belts, shoes, pictures. These are all tangible things that we usually will not wear away. And it's advisable that you keep them just in memory of someone. If you are the type who thinks you are better off without those items, then that's okay.
Okay.
Yeah,
Because you know yourself.
You know yourself, and that's okay. But don't deliberately put them away, thinking that you'll be fine. There'll come a time where things will be much better emotionally, and you realize that you're going to have a lot of regrets when it comes to that.
So, Marsha, let me ask this one before before we wrap up. In case you want to reach out to us, me personally, or for me to connect you to them, 0559535554. It will be on the screen as well. So pick it up, call me. It is my direct contact. And as I said, you can follow me on all social media handles at Chaplain Abedi Bidiaba. You can. I'm sure that it will be on the screen as well. So just ask me questions so that probably if you want me to connect you, we'll do so to do that. And we are in to help you and all of us who watch Wounds of the Heart. Marsha, somebody will say that like I've lost someone dear to my heart, probably that close. And during the funeral, I didn't cry, I didn't do anything. But after 2 years, I felt it. Is it normal that way?
It's not a norm. but it happens.
It happens.
It does happen. So I think I slightly brief on it that it happens that you can have a delayed grief. So maybe this person was really, really in denial for a long time. Okay. So what you would want to know after the person realized what followed next. Okay. So you look at the behaviors, you look at the thoughts, you look at the frequency, in duration. Yes. So if it becomes with extreme emotions, then means you need to seek help. Yes. So Mental Health Authority, for example, has a free toll line. So people can Google and call at any time when they feel they're not coping well. Maybe if you're happening in the night. So I think they have your contact as well. And yeah, so you need to seek help. So the first point would be definitely speak to the closest people around you. Good support. You could be your pastor. You could be your friend. It could be your colleague. It could be even your own immediate family. Okay. And then you graduate. Okay. So you seek help and find to get some answers. So it is not the norm, but it definitely happens. Yes.
Before your final words, what are some of the words we are supposed to avoid during
God
grief?
takes, God gives. God gives, God takes.
God.
Yes, God gives, God takes. Yes. Yes, it's very hard. And for people who have lost babies, who say, oh, don't worry, God will replace it with twins and triplets. It is very hard. Also, God knows best. Okay, these are things that are
common. We say,
yes,
we say
it all
common.
the
Pastor
time.
say it every.
Yeah,
you say it. You have been saying it. Yes,
we've all been saying it, and it is very hard. So what you should, sometimes people have different ways. I've heard quite a few things also in line of practice, and you would wonder, because, sorry, some of them are in the local language,
exactly,
I'm not able to explain. But I'm sure, Pastor Daniel, you've also heard
plenty, much.
So you can share with us. But so I think what we should be concentrating is what should we rather say.
Exactly.
Sometimes you don't have to say anything at all. Just sit by the person, hold their hand in silence. But before you could do that, you should be able to know whether you can be comfortable with silence. If you're not comfortable with silence, don't start. Don't try it, because you feel very much overwhelmed. By the time you realize you might be going through that trauma even more than the person. Okay, so sitting with silence, holding the person's hand, giving the person a hug, asking, I'm here to listen. If you want to, you can call me, and I'm not going to talk. I'm just going to listen to you. Sometimes you can tell the person, when you feel overwhelmed, you can send me a voice note, and later you can delete it. Okay, I don't have to listen to all. If you don't want me to.
You express it with
more like just support. You are there, but you are not commenting on things. If they feel like, was this really my fault? Okay. What are you going to say? Of course you say, no, it's not your fault. But that's not sometimes what you want to say. It's like, allow yourself to feel it. Give it a bit of time. Maybe things will become much clearer for you after a week or two. Give it a bit of time, and you have to listen to the kind of questions they ask. If obviously you have a loved one who expresses a lot of wishes about death or threats, you need to take the person seriously and then report it at the right place.
And report it at the right place. Marsha's final words will go like this. If somebody is grieving and feel completely broken-hearted or broken down, what words will you tell the person now? If somebody is grieving and that person is completely broken, what are you going to tell the person now as she watches us or he watches us?
I could only imagine. I don't understand what you're going through, but I could only imagine. And looking at you, this looks like it's really painful, and I'm really sorry. We're
really sorry. Grieving is not sickness, it's a feeling, it's an expression at a point in time, as Marsha started saying. So if you have somebody who is going through that, and that person still can't cope because of the closeness of the person who is gone, please, as I said, 0559 535554, please don't hesitate to call or send a voicemail or text message that, Pastor, I watch your program, and I would give you. Or you can better still send your comment or your questions or anything via the social media on Hope Channel Ghana. Any comment, just put it down there. You can drop your contact there. They will get it to me, and I will do the justice by calling you, because we need you alive. And that's why I bring experts right here on this program to make sure that things that you may not have the chance or the access to go out there to listen or to hear about, I bring people here for you to watch, learn something, and help yourself and help others who are may be going through the same thing. Masha Boy, she has been a good person to me from the beginning of this program, and I pray God's guidance and grace and favor upon her life. And as I said, she's so much into baby children, like she loves them as well. She's a clinical and health psychiatric. She does a lot of palliative care. I don't know. I need to learn something from her on that. She's part of Ghana's palliative care, and she has been doing it tremendously well. Marsha, my viewers say God bless you for coming, and we really appreciate your time with me here. And I know you have learned something. Please, don't give up, because we are here to support you. It has been your regular host, and this is Wounds of the Heart, and I am Pastor Dana Bidibidiaba. I'm out.